most importantly is to evaluate getting a story just to see if it's something that's dangerous. Is this something that needs to be addressed, or is this something that needs to be addressed right now? So I can usually say, look, this can wait a little bit, but I wouldn't wait too long. I'm not quite sure what this is. Here's the risks. Here are the things that I'm concerned about. And if we sit on it too long, this is what could happen. And if I have to, and I have to explain that, and if the patient's willing to take that risk, then I'm doing the best that I can. Now, there are scenarios where I say, look, this cannot wait. And I know that you are concerned that you might pick up something like COVID. However, the risk of that is outweighed by the risk of what I think you might be dealing with. You schedule a virtual appointment and tell me that you're having chest pressure, and I'm concerned that this might be a heart attack, I'm going to recommend that regardless of what your concerns are, you need to go to the emergency room. And I've done that on occasion with some patients of mine that unfortunately had symptoms that were a little bit more important than what's going on. And also bear in mind, emergency rooms have had very good plans in place to get people through them, as are doctors' offices. They have very good plans in place to get people through them with the least amount of risk of contracting COVID-19 if there happened to have been an exposure in that area. So, we're doing the best that we can. Some concessions have been made. There's some patients that we talked to and said, hey, again, this can wait a little bit. I usually get you in every now and again so I can monitor this, but I'm willing to let that go a little bit further. And everyone kind of gets it. So, but when things do get a little bit out of control, you have to explain to them that this is, unfortunately, you got to get seen.